Hello everyone, Professor Zeep here again. And I'm going to teach you about autism and autistic spectrum disorders. It's a really interesting one here. Autism spectrum disorders formerly was called pervasive developmental disorder, but it had been changed because a lot of the variability, it does contain a huge sort of variation of behavior and different symptoms ranging from mild to severe. So it's one of those really diverse sort of disorders or sets of disorders that we're going to find here. All right. What we know about autism, just to kind of give you some information here, is that the rates have been increasing. So for example, in 2012, for 8-year-olds, it was 1 in 68, which used to be 1 in 2,500. So we've seen those rates been going up. And we also know that it's a lot more common in males. So for example, it is 5 times more common in males. All right, so let's get to our slides here, and then we'll get more specific as we kind of go here. Okay, so once again, autism spectrum disorders, formerly known as pervasive developmental disorder. This is, split up in different categories, if you would, which actually used to be separate disorders. So the one we're going to talk about first is autistic disorder, which is generally thought to be more severe in nature. So we are going to see some deficits here. So the deficiencies, and we're going to talk about each one of these. Social relationships, abnormalities in communication, restrictive, repetitive, and stereotypical patterns of behavior, are most typically of what we would see there. So in other words, they have problems connecting with people, with social relationships and social communication, the ability to use language as an example. And then we find some really kind of striking behavioral, almost ritualistic type behavior happening with some of the autistic folks there. All right, so let's kind of go through these. So with social relations and communication, we're going to see some patterns there. Keep in mind, about 25% of autistic people never acquire useful speech. So about 25% according to research and so forth, meaning that they can't communicate their needs effectively is sort of what I mean by that. Another kind of interesting feature about autism is something called echolalia, where we see that they would repeat speech. So it's repeating of speech of others, or at least part of it, even if you're asking them questions. And what's interesting about this one is not only would they repeat the information in some cases, they may actually repeat the tonation that you actually use, the intonation of your speech. So for example, if I said, "Hi, my name is John," they may say something like, "My name is John." In other words, not only repeating it, but they're kind of using the same tone in the response in some cases. Some of them may be unwilling to carry on conversations or have no interest in connecting with people. So once again, it's hard to reach someone when they're kind of showing that particular behavior. So they may not speak, they may repeat words. We do see some deficits in their working memory as well. So we see a lot of cognitive issues surrounding autism. However, one of our most striking ones is the restricted, repetitive, stereotypical patterns of behavior, where we see certain ritualistic type patterns. So for example, one of the things noted with autistic folks is they show a maintenance of sameness. In other words, they like things to happen in the same way. They don't like changes in some cases. So in other words, they have a preference for things to be the same. So I can kind of relate to this one. When I was a substitute teacher, I used to pick up special day classes, which is part of special ed, obviously, where it's a small number of students who have different disorders, including autism. And I remember with this particular class that during a certain period or time during the school day, we would have to transition activities like every 15 minutes. So they would have reading time and then math time and then something else. I remember this one particular child that I was working with, whenever that transition happened, they would simply start screaming. I mean, it was really hard to kind of deal with because you feel so bad for them and you can't calm them down, but they did not like that transition. They would just scream and scream and scream, and it's just really, really difficult to work with. So my hat is off to those people who work with autistic children and those folks every day, because it takes a special person, a lot of patience, and really a caring person to be able to do that. So I really respect and honor those people who can do that on a daily basis. Other things they show are these stereotypical behaviors. So for example, they may spend countless hours counting things. They may bite their hands repetitively. Hand and finger flapping is another pretty common one. So in other words, they may do things in a very pattern or ritualistic way almost, where it's stereotypical in nature. So rituals, wanting sameness, or just simply not reacting like people without autism would to different situations, as an example, okay? All right, so let's kind of move on. Next we go to Asperger's, which formerly was its own separate disorder, but has now been included inside the spectrum, autism spectrum disorders. Okay, so with Asperger's, the way I kind of think about it, it's a higher functioning sort of autistic individual. Okay, so once again, higher functioning. In fact, these guys are called the little professor syndrome, is how it's often related to. So they tend to have really good verbal language skills, so often are very skilled in that particular area. Some of them are part of the characteristic of this syndrome is to have a restricted range of interest and relationships. So they may be sort of narrowly focused on one particular area, depending on what that is. Sorry guys, as I'm flipping through my notes here. Okay, autism spectrum disorder can often be detected pretty early. So for example, usually between 1 and 3, which is pretty phenomenal at that age group to be identified. In fact, a lot of times symptoms do show up before 36 months, according to our research here. So it can be detected early. However, sometimes it may not be till later. Some of our causes for this one are genetics. So we think there's several genetics that contribute to autistic spectrum disorder. Other theories of what causes autism are lack of connectivity in the brain and the neurotransmitters. So the neurons are not functioning appropriately and creating problems. We do have some evidence that the age of parents seems to be a factor in autism. So older parents do have a higher chance of having a child with autism, according to research. And if you're over 40, remember we talked about this in class before with other problems, but being over 40 and becoming a parent, you are 5 times more likely to have an autistic child compared to someone below that age or someone who's younger. And by the way, this is both mothers and fathers. We're finding a connection. So we do see some connection to age of parents there. All right, so this will kind of conclude our short lecture here on autism spectrum disorders. Please move on to the next step in the class.